Hi guys, welcome back to the treatment. It's Dr. Rahi. Today I'm very excited. I have Dr. Joy Kong on. She is a triple board certified physician who specializes in stem cells, peptides, and ketamine therapy. Today we're going to be discussing stem cell therapy. I'm very excited to discuss this important topic. Please welcome Dr. Joy Kong. Hi everyone, welcome back to the treatment. Today I'm really excited because I have Dr. Joy Kong here. I'm really excited to talk to her because she's a specialist in stem cells. She is a UCLA trained, triple board certified doctor, triple board certified in psychiatry, neurology, American Board of Addiction Medicine, and American Board of Anti-Aging Medicine, right? That's a lot of education. Her passion is stem cells and also ketamine therapy, and she is the president of Uplift Longevity Center in Los Angeles. Thank you for being here.
Thank you. I'm excited to chat with you.
Me too. I've been wanting to do this for a long time. I'm really excited to learn about what you offer in your clinic and how you're helping your patients every day.
Yeah, it's been a while. So I've been doing the whole regimen for about 6 years, with stem cells. So it's been a great journey.
That's interesting. How did you get into stem cells, and what are stem cells?
Yeah, well, we all learned in medical school about stem cell therapy. But, we sort of learned just the basic concepts. So when I met this doctor who actually was doing stem cells about 6.5 years ago, I was very surprised. He said he was injecting stem cells into people. I said, you can do that? I thought people were still doing research on this. So this is how doctors get trapped in bubbles. So I had no idea that, all these therapies are ongoing. But if you're wrapped in your own bubble, which my bubble was psychiatry, addiction medicine, there's no way for you to know what's going on in real life and research and in cutting edge medicine. So he told me that he was using stem cells for this little autistic kid and injecting umbilical cord derived stem cells into this little kid, and he showed me about 40 things of changes that this kid, that the teacher noticed in this kid. And this is an autistic kid. And for me, as a psychiatrist, there was a reason that I didn't want to go into child psychiatry, because I realized just how frustrating treating autism was. There's really no good way of treating it.
Right.
The psychiatrists were just sedating the kids. And
right.
So when I saw fundamental changes in behavior, the ability to play with other kids, in language development, in social interaction, lack of procrastination, just like many, many things. So I was in shock, and I was like, this is amazing. This is not just in theory, this is actually in action. That
right.
We're using something that we learned can be powerful, but still only in books, but actually is already in practice. So I looked into it, and I saw how the stem cell treatments have benefited people from all kinds of conditions, autoimmune being one of the biggest categories. So that's how I decided, okay, I think this is just incredible. This is too much fun. So I wanted to get into it. So to answer your question, stem cells are primitive cells that still have a lot of potential to become different types of cells in the body. So they have the ability to multiply themselves, but still preserve themselves, so they can always save themselves, in your body. But in the meantime, we'll develop cells with more capacities to replenish tissue that needs repair.
Right.
So these are the characteristics of stem cells. And my first patient I treated was a patient with knee osteoarthritis. So I just inject into the knee and also did an IV infusion, because you want to target the knee from two angles, from blood supply and from the synovial fluid. And the results were just incredible. Not only I fixed his knees that 2 orthopedic surgeons said he absolutely needed bilateral knee replacement. Apparently he didn't. I did 1 infusion and injection, and this is six years later. He's walking 4 miles every day, barely feels that he has knees. He goes to more trade shows than anybody I know. And then what's interesting was that the rotator cuff injury that he had and he had dealt with for 40 years, that was waking him up every night for 40 years. Every time when he shifted his bed, the sharp pain would wake him up. That was fixed. The next day, he said, I slept through the night, and I haven't done that for decades. Wow. And I didn't even know about it. So this is what got me hooked, right? So it was like, wow, I can do something that's so powerful. I'm not even trained in orthopedic surgery, or like I was a psychiatrist, addiction specialist, but I'm a doctor. I want to heal. So to be able to use something so elegant and so simple, and it can exert so many benefits, widespread benefits. Without touching his shoulder, I fixed his shoulder. So that was an incredible feeling as a doctor.
Wow, that must be an amazing feeling to be able to do that. How soon after did he start noticing a difference?
Well, the shoulder, the next day. The knees was gradually getting better within a few weeks. The pain was a lot less, and he was walking with no problems. And so oftentimes with joint repair, it would take about a couple of months. I would say between 4 to 6 weeks.
And how many sessions?
A lot of times with one session, people are doing great. Sometimes you may need another one if it's really severe, possibly a third. But I've treated a lot of people just one treatment.
That's amazing. What type of stem cells do you use?
So I've looked into this a lot because there's so many stem cell types, right? We can extract stem cells from your own body, either from fat or the bone marrow source.
Right.
Those are two most popular. But there's also another category where they're extracting cells from the birth tissue. So that's the placenta, umbilical cord. When the healthy baby is born, the birth tissue usually will be tossed into the biological waste basket. But nowadays, we know this is full of really powerful cells, more powerful than what's in the baby, because these cells are actually trapped when the baby was forming. So they're much younger than the baby stem cells. So they're in between embryonic stem cells and the baby stem cells. So they're full of regenerative potential. So now we can harvest them and put it back in the body. And what's interesting is that these cells from the umbilical cord and placenta are not only more potent than the stem cells from a person's own body, but they're also safer, because research has shown that when you use cells from the birth tissue, when you put in extra cancer cells, it make the cancer shrink away. But if you used the fat-derived stem cells and put in extra cancer cells, and make the cancer grow. So there's drastic differences. And the way I look at it is that when the cells are with you in your body, is aging with you. So sometimes it becomes older and it gets a little demented, and it's supposed to recognize cancer cells, and then it's lost that kind of capacity. So to me, it's my responsibility to give people the safest and the most effective. So then the birth tissue is the winner.
So you take the birth tissue and you just multiply it in the lab?
No, we don't do that in the U.S. So in the United States, if you want to give stem cell therapy, you want to provide stem cells and put in the person's body, the moment you start to grow them in the lab, the FDA says you're creating a drug. So this is why so many companies are going overseas, where they can multiply the cells to huge numbers. And most of those countries, Latin America, the Panama, Colombia, Mexico, Bahamas, they don't have the kind of regulation. So they're going over there because they don't have to conduct clinical studies. But in the US, you do. So that stopped a lot of companies because it's so costly to do clinical studies. But what's interesting is, even though a lot of people think you need this huge number of stem cells, you have to grow them to huge numbers, and then you can get a result, they are looking at what the research has shown. So the research are showing 1 million cells per kilo body weight, so that's a ratio, so everybody's adhering to that. But it doesn't mean if you use less cells and when it's not expanded, you can't get the same result or even better, which is what I've seen in my clinic and also in the doctors I've trained. Because we only use cells that have never been expanded, so they are called native cells. They have never have to gone through the changes outside of the body, and they are more potent. So at 1/5 the number of cells we're giving to patient, sometimes even 1/10, we're getting as good of a result, if not better. By expanding the cells out of the body, people have to realize, yes, you're selecting cells that can grow and are robust, but robust for what? For the petri dish. So the cells are adapted to live and to fight for their lives and to be able to thrive in the petri dish. So they're not adapted to the human body. So then when you bring them back into the human body after they have already differentiated in particular ways outside of the body, because they become more, they gain more function, they have more surface markers, and sometimes, expressing who they were before. When the stem cells, most of the time, it's pretty much a blank cell. They don't express who they were, right? Jane or Joan, it doesn't matter. On the cell surface, it doesn't show any difference. But when you let the cell differentiate, then they can express who the person was.
Okay.
And then you have more chance of rejection. So that's why there are more side effects in these expanded cells. But that's not what we use in the U.S.
Okay. So then, what are some of the myths surrounding stem cell therapy?
So that's one of them.
There's a lot of controversy, right? You would say.
So that's one of them.
Okay.
That more cells is better. That people think that you have to get 200, 300 million cells, otherwise, it's not going to work. That is simply a myth. And the other myth is that people, still these days, people think that stem cells are not legal in the U.S., which I don't even know how that myth is perpetuated. That somehow that people think that you have to go overseas to do it. No, stem cell therapy is definitely not illegal. In some states, it's proclaimed as legal. In Texas, it's definitely legal.
Legal.
Legal. Myth is perpetuated for a reason, right? There may be certain people who would love for you to believe that you absolutely cannot get anything in the U.S. You have to fly out of the country. But I can tell you it's absolutely not the case, because the FDA said themselves in their own policies that stem cells, if you don't change them in any way, such as expanding them in a culture, or you are using enzymes or chemicals to alter them, then you're using them as minimally manipulated. And if you use them the same purpose as what they were doing in the donor's body, so if it's doing about the same thing, then it's considered homologous use. So if you fit these two criteria, minimally manipulated and homologous use, then it's considered a tissue transplant, not a drug. Then you don't need to go through drug approval.
Okay.
And tissue transplant, any doctor can do, right? We're licensed as physician surgeon, and we can do blood transfusion, we can do organ transplantation. So this is all part of what we can do as doctors, is to provide tissue transplant. So that's another myth. What's another myth that?
I've heard of myths that someone injected stem cells and then they grew like a piece of bone in their eye.
Well, yeah, if you are using embryonic stem cells or even pluripotent stem cells, which are, induced pluripotent. The embryonic stem cell is a pluripotent stem cell, actually kind of, what's it called? It's like omnipotent, it can become anything, but pluripotent stem cells basically can become cells of all kinds of tissue in 3 germ layers. So when you use these very, very powerful stem cells, we still have trouble controlling them, and they can develop into tissues just on their own. They kind of lost control. So you're putting them, let's say, in the bone. You want them to become bone cells. All of a sudden, they become hair, and they become, piece of internal organ. So that's because they've gone haywire, and we're not able to harness their potentials. And that doesn't happen with umbilical cord derived stem cells. At a certain stage of development, the cells lose that potential to go crazy. But if you use embryonic stem cells or induced pluripotent stem cells, which is really kind of inducing them back to the embryonic state.
Those are like the earlier stem cells.
Yeah, those are.
So the umbilical, you found that when you use it, it just ends up becoming therapeutic?
Yeah, the evidence, because they've lost a lot of the potential to go wild.
Okay.
But they still have, lots of potentials to differentiate into different types of cells. So they're kind of harnessing the potentials of both worlds. So there's no potential to cause what you said, the type of tumor you're talking about is really a teratoma, is uncontrolled growth. That does not happen with umbilical cord stem cells. Yeah, or autologous cells. However, autologous cells can promote existing tumors. So it's not becoming tumor itself, but if you have cancer cells, which we all have floating around, our immune system just get rid of them. But if you put your own stem cells next to these existing cancer cells, oftentimes your own stem cells will tell them grow, because they think that's what they do. They give signals to tell everything to grow. But the umbilical cord derived stem cells are able to tell that there's something wrong with this cell. I am going to give the cell a different set of instructions to tell the cell to die. So that's why I'm passionate about giving people the right type of stem cells to reduce risks.
So you mentioned earlier that you initially learned about stem cells when you met a doctor who was treating an autistic child, and then you mentioned that you treated someone with a knee injury. So it seems like the different diseases that stem cells can treat is pretty vast. What would you say are like the top?
Yeah, first of all, I would never use the word treat.
Okay. Right.
Because the only FDA approved treatment using stem cells is hematopoietic, hemoreconstitution. So if somebody has a blood system disorders and we want to regenerate the blood, the circulating blood cells, white blood cells, red blood cells, then
Something like sickle cell?
yeah. So they could wipe out the person's own cells, right, in the bone marrow, and then they can transplant these stem cells, usually from either umbilical cord blood or from somebody else's bone marrow. Then it's an indication, it's an FDA indication. Everything else will be off-label.
So what would you call it?
I never say that I'm giving you these cells to treat this condition unless the person has the blood disorder. I would say let's look at the research. Has research, what's your problem? What's your condition? You have congestive heart failure? Okay, let's look at some evidence. So I founded American Academy of Integrated Cell Therapy for that one particular, powerful reason, which is to show evidence to all the doctors out there so they can share it with their patients. So everything's categorized. So I can just go to the section of the heart, and then under congestive heart failure, I can pull out articles of research that's been conducted from all around the world to see whether or not it has been shown to be helpful. So if it does, then I will tell the patient, look, there has been research that's really positive and really encouraging. So let's see if the stem cell therapy can help you. So that's my approach. But I always look at what the stem cells can do. Stem cells are highly anti-inflammatory. They modulate the immune system to help your immune system reach a balance. They can get rid of cells that are senescent and cancerous. They can preserve cells that maybe are damaged but don't have to die. They promote vascular formation, so you get new blood supply. And they break down scar tissue. They also are antimicrobial. So have this wide range of actions. So let's look at all these actions. Is that going to help you in your condition? So that's what I focus on. I don't talk about treating a condition. I talk about how the cells work and the research evidence.
That's very interesting. So other doctors can come and learn from you if they want to.
Yeah, so actually we have a online course I used to teach in person. It's under aaict.org. That's American Academy of Integrated Cell Therapy. And then I also have a program where I mentor other physicians, and I have monthly support for them, and they can come to my clinic for in-person training, and so it's
You're busy. What about the difference between stem cells and exosomes? Because now I've been using a lot of exosomes topically for anti-aging purposes, but what's your experience and the difference?
Well, exosomes has become a bit of a rage, partially because the people that started it, the rationale is reasonable. The cells conduct a lot of these functions and send out the signals through exosomes, which are these little packets that the cell's membrane just butt off and then send into space, and that will fuse with another cells and releases content, and that's how it exerts its effect and communicate with other cells. But Okay, one reason it has become popular was because these exosomes are not cells, they're not cellular. So the people who are providing them are thinking, well, then we won't be under the same kind of regulations, so we'll be, the government will be a little easier on us. So that was the case for a few years, for maybe a couple years, until the FDA caught on. So the FDA now says, well, this is actually more manipulated than just cells, because you have to grow the cells in a culture, and then the cells will start to spit out these particles, and you collect the particles and concentrate them. So this is more manipulated than the cells. So now there's a little bit more backlash and control, and so this is how the kind of the game was played, right. And that's one reason made it really popular, because all the doctors think, oh, I don't have to worry about the FDA regulations around cells. I could just use these particles. But now that's kind of going away. The problem with just using exosomes is that you are kind of using part of the power of a cell, because the cells not just only send information through these little particles, they also sends out growth factors right into the space, right? Just like, no, I'm not including the packets. I'm just sending it out. I'm just spitting it out. Just like it can spit out mitochondria into the space, and then another cell can take it up. Or it can put a mitochondria in a very large vesicle, which is much larger than the exosomes. Exosomes are really, really tiny. So they can put in a larger vesicle and give it to another cell. Or it can establish this microtubule between one cell to the next, and the mitochondria can walk across the microtubule and be deposited in a different cell, and elevating the energy of that cell. So for example, I'm giving people umbilical cord derived stem cells. These are very young, very vibrant new cells, right? And their mitochondria is very young. So these mitochondria can walk across, they've shown, migrating into macrophage of the recipient, so elevating the immune cell potential, right? Energy of the immune system. So cells can do so much more than what they can do through the exosomes.
Okay.
But also, when I give somebody cells, the cells can travel to places that they're attracted to. Once they get to that place, so they will come out of the blood vessel and then start to work locally. And they can respond to your local environment and give you exactly what you need locally. I call it like a little smart pharmacy, right? Traveling pharmacy, get to location, and spit out whatever you need. What's the issue locally? What is the problem? So let me give you appropriate signals, instead of just spitting out in a petri dish, right? Blindly. Here's what I secrete, and go ahead and collect them, and then treat everything. But it's not as targeted. So I love the fact the cells have that kind of intelligence, that they can select what to give you at the location that you need it. So these are the things that exosomes cannot do.
So when a patient normally comes to you, what are the first steps in order for them to become a patient, and how do you approach?
Definitely education is always the key. So we'll send them, very full list of information with all the questions that they may have. So I want them to be educated, and also some of my YouTube videos. I have a lot of very helpful videos.
What's your YouTube channel?
It's Joy Kong MD.
Okay.
Yeah. So a lot of patients actually find me through, digging information about stem cells, and then they find the video and find their way to me. So when they are educated and they want to proceed, then they fill out the patient intake form, and we schedule consultations so I can really target what the cells are going to be doing for them and what will be the appropriate dosage. I know some companies would do stem cell therapy. Everybody's saying dose. No, everybody should be different. This is, you're practicing medicine. Some people will need more, some people need less, some people may need exosomes, some people may not, and then also incorporate peptides. So maybe the peptides that are particularly helpful for this patient. I also incorporate ozone therapy right before stem cells.
So can you tell us a little bit about ozone therapy?
Yeah, so ozone therapy, it's, we call it ozone therapy. It's really an oxidative therapy. So it's 98% oxygen, 2% ozone, and that little bit of ozone will quickly break down into oxygen and ozonides. So all these ozonides have a lot of downstream benefit to elevate the immune function. It will help your body detoxify. and it will it's very it promotes your antioxidant system to come on board, and it also changes the red blood cells pliability, so they're more flexible, so they can squeeze through your capillaries easily, and it makes them release oxygen better. So it's no good when you have all the red blood cells holding on to oxygen, but you can't release it, right? So in that sense, you're nourishing all your tissues.
You do IV ozone?
Yeah.
Okay.
Yeah. So I do that before stem cells, and then we do stem cells, sometimes adding peptides, and then I may give them a Myers cocktail, glutathione.
Your patients are going to live forever.
They're pretty happy, yes. I got some very vibrant patients.
They're very lucky.
Oh, thank you, thank you. I'm grateful that people are educating themselves, and that they are excited for the cutting edge medicine, as excited as I am. So it's great. So,
but the one downside is the cost. How do patients get past that? I guess it's just
yeah, it is definitely on the more expensive side. I think what I charge in the clinic is quite reasonable. It's probably half of what they will have to pay when they go overseas. I try to make it affordable, but the products are expensive, and I think as long as the FDA has not formally approved the therapy for particular purposes, it does make it more difficult for doctors to feel comfortable providing the treatment.
Yeah.
So there's a little bit of a barrier and certain concerns for the doctors. So that's unfortunate, and that's partially what's keeping the price up as well. But looking at how much money is going to save them down the road,
that makes sense.
and a lot of people also are desperate, so they've tried everything. If you have a health issue that's making you suffer, and you tried everything that conventional medicine has to offer, what do? Are you going to just keep suffering, or do you put your resource into something that can potentially help you? So I do have a lot of patients who said, well, my health is worth everything, and even if I have to borrow money, that's what I'm going to do. They see the value in it. So
that makes sense.
Yeah.
That makes sense. What type of research are you involved in currently?
So right now, I originated in the traumatic brain injury study. So it's for people who have had a traumatic brain injury aged 18 to 60, and they've had history of losing of consciousness, and they still have a lot of problems, either psychological, neurological.
Like football players, perhaps?
Oh, yeah. Any kind of sports. It's pretty easy to get injured. You don't have to be a pro to be injured. I think the traumatic brain injury is much more widespread than what people think. Even I have traumatic brain injury, and I have no idea how I got it. So, but it showed up on the brain scan.
Oh no.
So I don't know, maybe I fell as a baby, or maybe that boy who hit me when I was a teenager.
What? I'm sorry.
Knocked me on the ground. Well, I tried to hit him first, but so I don't know what happened. It didn't seem like a big deal, but I've got traumatic brain injury. So has it been impacting me? Very possibly. So I think
you're doing great.
Thank you. I have my struggles. So everybody, I think can benefit from stem cell therapy. But
it seems like
traumatic brain injury, I think, is very powerful just because of how widespread it is and just how much suffering it has caused. So that I'm actively doing. We do before and after brain scans, and so I'm excited about that study.
That sounds very interesting, and it seems like it could potentially help an illness that really there's not much for traumatic brain injury. There's not like that much great therapies out there.
Not at all. And I was having veterans in mind, really when I was designing the study. That's I've worked a lot with veterans, and that was the population I really wanted to help.
Oh, that's amazing. There's so much more to learn about stem cells, but this was great. I feel like it was a great introduction for everyone to learn more about the potential of stem cells, and If they want to come visit you, how do they find you other than your YouTube channel?
So my clinics is in Los Angeles, in San Fernando Valley. It's called Uplift Longevity Center. So Uplift with a Y. So if you just go online, upliftcenter.com, you can find me.
Oh, cool. Nice. Thank you for coming
You're
and
so
spending your
welcome.
time with me. And I hope to see you soon. I actually want to invite you back to talk about ketamine therapy.
Oh,
Because I know you offer that bit for the next episode.
Sure. Okay.
All right,
There's a lot
great.
to talk about there.
Yeah. Thank you. Bye.